All right, we are going to take you now here to New York State, where Governor Andrew Cuomo is delivering his daily briefing on the coronavirus pandemic. Let's listen.
You are safe if you're acting smart. What does smart mean? Phasing it in by metrics, just study what's happening. Continue to test so you have an idea of the growth of the virus, trace those cases, isolate those positives, watch your hospital capacity, and monitor what's going on. So all your actions are based on data. We post all the data. Anyone in the state can go online, see where they are by their region. The Long Island and Mid-Hudson region, if the number of deaths continues to decline the way it has, and they get their tracing online. Every region has a certain number of tracers that they need to reopen, because we want to make sure when they reopen, they have the testing and tracing operation working. But if the number of deaths continues to decline, they get their tracing up and online. Both regions could reopen this week. In anticipation of that, we're going to allow construction staging. Phase 1 construction begins. Before you can begin construction, you have to have staged the construction. The materials have to be on site, et cetera. The safety precautions have to be on site. So we're going to allow that construction staging now for the Long Island and the Mid-Hudson. We're hopeful that the number of deaths continues to decline, and then they would be reopening this week. Testing is a big component of all of this. New York State tests more than any other state per capita. We test more than any other country per capita. So we are far ahead in terms of getting this operation online. And this is the first case. Nobody's ever done this before, putting together this tracing and testing capacity. But we've signed up another 52 independent pharmacies. That brings the total number of sites in the state of New York to 750. And our message is very simple. Get a test. We have state-run sites where we have more capacity than we're now performing tests. We have some drive-ins where we can do 15,000 tests. We're only doing 5,000 per day. Get a test. If you have any symptoms of COVID, which are basically the same symptoms as the flu, if you have any symptoms, get a test. If you were exposed to a person who you find out was positive, get a test. Get a test. And you can go to this website and they'll tell you exactly the site closest to you. In terms of tracing, all the regions that have come online had to have the right number of tracers. That's where we're talking about. Mid-Hudson and Long Island has to get their tracing numbers up. But every region has the tracing functioning. Mike Bloomberg, former mayor of New York City, volunteered to have his Bloomberg Philanthropies put together a tracing program, because there is no such thing as a tracing program. How do you train tracers? How do you recruit tracers? What software do the tracers use? They've been doing that with Johns Hopkins. They've been fantastic. We have that in place now, and we're going to share that with other states online, and we're going to do that with the National Governors Association, because New York is ahead, and we do have more advanced curriculum and training and protocols. So we're going to work with the NGA and make that available to any state that wants to use it.